What causes blurry vision after eating? The link between carbs, blood sugar, and vision. Blurry vision after eating occurs when a rapid increase in blood sugar levels causes the lens of your eyes to swell. This changes the shape of the lens, thereby affecting your eyesight. Blurry vision in general is one of the earliest symptoms of diabetes. People without a diabetes diagnosis who experience blurry vision after eating should see a healthcare professional, especially if they have diabetes risk factors. Left unchecked, diabetes can lead to serious complications, including blindness. This video discusses the causes of blurry vision after eating and explains why it occurs. It also explains diabetes eye complications and treatment. High blood sugar and blurry vision. Vision is a complex process. Light enters the front of the eye, known as cornea, and passes through to the lens. The cornea and the lens work together to focus the rays into the retina, the thin light-sensitive tissue located at the back of the eye. The retinal cells then absorb the light and convert it into electrochemical impulses. They are then sent along the optic nerve and to the brain, where they are translated into image you see. Eating a meal high in carbohydrates can cause a sudden increase in blood sugar levels. This is called postprandial hyperglycemia. It happens as your body breaks carbohydrate down into sugars which enters your bloodstream. Carb-heavy foods that may cause a blood sugar spike include bread, pasta, potato, white rice, baked desserts, candy, breakfast cereal, sodas and other sugary beverages, ice cream, fruit juice. Sudden high blood sugar causes fluid to move in and out of the eye. As a result, the lens swells, changing its shape and blurring your vision. When your blood sugar levels return to normal, the lens returns to its original shape, restoring regular vision. The effect can last for a couple of days. Other symptoms of diabetes. Blurry vision after eating is just one symptom you may experience if you have diabetes. Some others include excessive thirst or hunger, losing weight without trying, fatigue, numbness in your hands or feet, dry skin, excessive urination. Symptoms associated with diabetes often go unnoticed because they can either be mild or non-specific. This is why it's important to see a healthcare provider for an annual exam, especially if you have risk factors for diabetes. High blood sugar, also known as hyperglycemia, is possible if you have normal or pre-diabetes blood sugar levels. Still, make sure to see a healthcare provider if you have blurry vision after eating and/or any of these other symptoms. Risk factors for diabetes. Type 2 diabetes is the more common type of diabetes than type 1. About 1 in 10 Americans have diabetes, and 90% to 95% of them have type 2 diabetes. The risk factors for type 2 diabetes include having prediabetes, family history of type 2 diabetes, being 45 years of age or older, being overweight, being physically active fewer than 3 times a week, having had gestational diabetes, having non-alcoholic fatty liver disease. Unmanaged diabetes can potentially lead to vision loss. People with diabetes are at risk of developing diabetic retinopathy. This condition occurs when the blood sugar causes damage to the retina. If diabetes remains uncontrolled, it can result in blindness. Diabetes can be diagnosed with one of several blood tests. If your tests are normal, your healthcare provider may consider other potential causes for your blurry vision, such as allergies, migraine, a bacterial or viral infection, and medicine use. Diabetic retinopathy. Diabetic retinopathy is an eye disorder associated with diabetes. It can happen in those with type 1 and type 2 diabetes, and is typically associated with those who have uncontrolled diabetes. Early diagnosis and treatment can lower the risk of developing diabetic retinopathy. Diabetic retinopathy progresses through 4 stages. In the early stages, blood vessels in the retina begins to swell and leak fluid. Over time, the swelling increases and fluid builds up in the macula at the center of the eye. In later stages, blood vessels become blocked and new blood vessels start to grow. Because these new blood vessels are fragile, they may leak more fluids into the macula, causing vision problems such as blurriness and reduced field of vision. In the most severe cases, blindness can occur. There are often no symptoms in the early stages of the disease. As diabetic retinopathy progresses, blurry vision may be a key symptom. You may also start to see dark spots in your vision and experience a change in colors you can see. Diabetic retinopathy can't be reversed. As it progresses, the damage to your vision will be permanent. However, you can prevent this by receiving a diagnosis and treatment in the early stages of the disease. What to do if you have blurry vision after eating? If you experience blurry vision after eating, it's important to seek medical help as soon as possible. Blurry vision after eating is a clear sign of diabetes and should not be ignored. Meanwhile, paying attention to what causes your blurry vision after eating can help prevent it from occurring. Try lowering your carbohydrate intake and choose foods that cause a gradual rather than rapid increase in blood sugar levels. You can also help keep your blood sugar in check by eating smaller, more frequent meals, drinking plenty of water throughout the day, and eating higher fiber foods. If your rise in blood sugar is not associated with any serious symptoms such as shortness of breath, nausea, vomiting, or dry mouth, you could try exercising as a way to lower your blood sugar. The level of exercise does not have to be strenuous. Research has shown that just a 15-minute walk after every meal can help manage your blood sugar levels for a 24-hour period. If you are already being treated for diabetes and you get blurry vision after eating as a new symptom, talk to your healthcare provider. Your diabetes management plan may need to be revised. Does blurred vision always mean diabetes? No, blurry vision is a symptom of diabetes but can also be caused by other things. Refractory errors, meaning you are nearsighted, farsighted, or have astigmatism, are one example. Can digestive problem cause blurry vision? Possibly. Research links irritable bowel syndrome to dry eye disease. When your eyes are dry, it can become difficult to focus. Precisely why IBS can cause dry eye is unclear. Can high blood pressure cause blurred vision? Yes. Hypertension can lead to vision problems. High blood pressure can damage blood vessels in the retina, the layer of the eye that changes light and images into nerve signals sent to the brain. The damage occurs slowly over time. What else might cause blurry vision? There are several other common causes of blurry vision. Some are minor and will go away on their own. Others will need medical treatment as soon as possible. Some of these other causes of blurry vision include eye strain. Eye strain from computer work, reading, driving, and other activities can lead to temporary blurry vision. Allergies. Allergies can cause your eyes to itch and burn and might lead to blurry vision. Migraine. The aura before the migraine can cause blurred vision. Medications. Certain medications can cause blurry vision, including antidepressants and heart medications. Conjunctivitis. Conjunctivitis is also called pink eye. This common infection is spread easily and can be caused by a virus, bacteria, or allergies. It often causes itchy eyes and blurred vision. Eye injury. An eye injury such as corneal abrasion can happen when something scratches the surface of your eye. It can lead to blurry vision and the feeling that there is something in your eye you can't remove. Keratitis. Keratitis is a bacterial infection of your eye. Often, it's caused by unsafe contact lens use, such as wearing the same pair of contacts for too long. You might also have eye discharge with this condition. Detached retina. A detached retina is a medical emergency that happens when your retina tears away from the rest of your eye. It causes sudden flashes of light, black spots, and an area of blurry vision. It may also cause a sudden storm of floaters, or the appearance of a curtain coming down over your vision. It can lead to permanent vision damage or loss without treatment. Angle closure glaucoma. Angle closure glaucoma occurs when your eye's drainage system is blocked, leading to pressure, swelling, and blurred vision. Angle closure glaucoma is a medical emergency. Wet macular degeneration. Wet macular degeneration is caused by abnormal blood vessels growing in the center of your retina of your eye and leaking excess fluid. This condition progresses rapidly and is a medical emergency. These causes normally have additional symptoms that blurry vision after eating does not. On the other hand, you might be experiencing other symptoms of diabetes or carotid stenosis along with your blurry vision after eating, but those symptoms will look very different than symptoms that go along with eye-related causes. For example, blurry vision followed by a pounding headache is generally caused by migraine, and blurry vision you have alongside eye itching and eye discharge is largely keratitis. Any blurry vision that is not relieved by rest or that keeps returning should be evaluated by a medical professional. Sometimes it can be a sign of a medical emergency. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.